Welcome to this session on Applied Ethics. Here we discuss one of the bioethical issues, euthanasia. Bioethics is concerned with questions about basic human values such as the rights to life and health and the rightness or wrongness of certain developments in healthcare institutions like life technology, medicines, the health professions, and about society's responsibility for the life and health of its members. Bioethics involves issues relating to the beginning and end of human life, all the way from issues relating to in vitro fertilization and abortion to euthanasia and palliative care. Euthanasia. The word euthanasia is derived from the ancient Greek language and can be literally interpreted as good death. Euthanasia causes a person's quick and painless death, usually by lethal injection or drug overdose. It is the intentional killing of a patient in response to his or her informed and voluntary request. Thus, it is the intentional and painless taking of the life of another person by act or omission for compassionate motives. Despite its etymology, the question whether or not euthanasia is in fact a good death is highly controversial. Euthanasia is sometimes also considered as a manifestation of autonomy and the control of one's destiny, and at other times it is associated with the failure to provide adequate palliative care for the terminally ill and the dying. We can classify euthanasia into three: voluntary, non-voluntary, and involuntary. Voluntary. When euthanasia refers to the taking of human life on request of that person, it is voluntary. Non-voluntary. Euthanasia may also occur without the request of person. Euthanasia is non-voluntary. Involuntary. Euthanasia refers to the taking of a person's life against that person's expressed wish or discretion. When discussing on euthanasia, the main concern is the notion of intention. While death may be caused by an action or omission of medical staff during treatment in hospital, euthanasia occurs only if death was intended. For example, if a doctor provides a dying patient extra morphine with the intention of relieving pain, but knowing that his actions may hasten death, he has not performed euthanasia unless his intention was to cause death. Principle of double effect. Euthanasia may be distinguished from a practice called physician-assisted suicide, which occurs when death is brought about by the person's own hand, that is, by means provided to him or her by another person. Voluntary euthanasia. When euthanasia occurs at the explicit request of a patient, it is referred to as voluntary euthanasia. A few governments have rendered this form legal, or if not completely legal, it has been decriminalized. In some countries, voluntary euthanasia is classified as homicide, but if a doctor can satisfy certain legal requirements, it is not considered criminal homicide and he or she will not be prosecuted. Voluntary euthanasia is the termination of a person's life with the explicit consent of that person, typically for reasons relating to health or quality of life. It is usually performed in consultation with a physician or medical professional using a variety of drugs that purportedly end life painlessly. Euthanasia, even when voluntary, is not legal in all societies, and so some people choose to travel to areas in which they can choose to die. For many people, voluntary euthanasia is a question of personal rights. while for others it is a question of absolute morality, which makes it very difficult for consensus to be reached on this issue. A person might choose euthanasia because death is difficult or he or she has no will to live. There are a variety of other possible reasons that a person might be euthanized voluntarily, but many of these are not acceptable in any location under current medical and legal guidelines. For instance, some people believe that humanity is a blight on the earth, and these people might choose voluntary euthanasia as a moral exit from the world. Simply choosing to die is not enough for a death to be considered voluntary euthanasia. Involuntary euthanasia. Involuntary euthanasia is the ending of a person's life without his or her consent, typically due to the perceived lack of worth of that life. The intended semantic difference between this type of euthanasia and murder is that murder is an aggressive act intended to punish, whereas euthanasia is usually used for situations in which life is ended for philosophical or purportedly rational reasons. In many people's opinions, there is no difference between these two terms, nor is there always a legal difference. Generally, when a person refers to involuntary euthanasia, it is in a philosophical or conceptual sense, because actually practicing euthanasia without a patient's consent is almost always considered murder in today's legal systems. Non-voluntary euthanasia. Non-voluntary euthanasia is when a person is unable to give his or her consent to the procedure, such as when he or she is unconscious, comatose, or legally incompetent. It is also referred to as non-voluntary when a person has previously expressed his or her wish to die under specific circumstances, but cannot at that moment speak for himself or herself. Children generally are perceived as legally incompetent. For example, children cannot sign legal contracts, and this logic applies in the case of euthanasia as well. Child euthanasia is internationally held to be illegal in almost all cases, although some places might specify particular circumstances in which it is permitted. Distinction between non-voluntary and involuntary euthanasia. Non-voluntary euthanasia is sometimes erroneously confused with involuntary euthanasia. The term non is carried out without the patient's consent, and involuntary means that it is done against the patient's expressed will. Slippery slope arguments are often made against all forms on the supposition that legalizing one form of it might someday lead to cases of the other. When euthanasia is performed without a person's consent, this is considered involuntary euthanasia. The person may violently resist euthanasia if it is being performed actively, meaning that actions are taken to actively kill the person. In most cases, this type of euthanasia is performed by withdrawing care rather than actively killing a person. This may be done without the patient's knowledge, often by a doctor, or without the patient's consent when he or she is mentally incapacitated. Assisted suicide and euthanasia. An assisted suicide is also called euthanasia. It is a situation in which a person helps another person to end his life. This type of mercy killing is often used to put an end to a painful condition from the patient has little to no hope of recovering. It may also be used when patients are unable to function normally or live without extreme measures. In such cases, the idea behind assisted suicide may be to allow the patient to die with dignity. Typically, euthanasia is employed when a person is unable to take his or her own life. There are opponents and proponent sides of this issue. Proponents of assisted suicide often state that a person has a right to end his life if he is in severe pain or unable to experience a reasonable quality of life. They further state that he has the right to seek help in ending his life as well, arguing that euthanasia doesn't harm anyone. Some even call it cruel to force a person to live the rest of his days in pain or unable to move or function. As such, proponents often consider it an act of kindness to help such patients die. There are also many arguments against assisted suicide. These arguments are religious in nature. Many opponents of mercy killing say it's outright murder. Some people who are against euthanasia state that it leaves too much room for mistakes. For example, they say that assisted suicide may lead to the deaths of individuals who were incorrectly diagnosed or had some chance, no matter how remote, of recovery. The arguments against assisted suicide focus on where society should draw the line in deciding who should die and what conditions make a person a good candidate for mercy killing. They question whether society would eventually force euthanasia on people who were considered less desirable or who had non-fatal but debilitating conditions. Many arguments focus on the sanctity of human life and that mercy killing will make people have less respect for it. Active and passive euthanasia. In terms of procedural distinctions, there are two types, active and passive. Active euthanasia implies actions being taken to end another's life, such as a lethal substance being administered. Passive euthanasia occurs when life-saving actions or treatments are willingly withheld. In many parts of the United States and other countries, it is legally acceptable for a doctor to acquiesce to a patient's request to cease the use of life-sustaining treatments. Involuntary euthanasia is not always considered the same as withdrawing the treatment for a person who is dying and cannot legally give consent due to a coma or other impairment. This is usually considered non-voluntary passive euthanasia, which generally means that while consent cannot be obtained from the patient's interests are being represented because he or she is going to die very soon and will not regain consciousness at any point. Children with severe birth defects are sometimes subjected to non-voluntary euthanasia of an active type, which is usually thought of as mercy killing. The legality of these actions depends on the country and area in which the euthanasia takes place, and public opinion of these proceedings may not always reflect the law. Active euthanasia. Active euthanasia is a form of euthanasia in which a doctor takes an active role in ensuring that the patient dies. This is typically in contrast to passive euthanasia, in which a doctor merely withholds treatment in order to ensure the death of a patient. Active euthanasia is typically more controversial than passive euthanasia and is only legal in a handful of countries or regions within certain countries. Active euthanasia typically involves direct action on the part of a physician to ensure the death of a patient. There are a number of different ways in which this can be done, though the most common is typically an increased and overdose of medication that is used to reduce pain. By using this type of method, active euthanasia usually involves no pain for a person and simply shuts the person's psychological system down as he or she sleeps. Active euthanasia is often very controversial due to the fact that a doctor or other medical professional must actively make an effort to end the life of a patient. This is typically done for a patient who repeatedly requests for the end of his or her life. Most doctors who perform active euthanasia will only perform it on someone who is suffering from an illness that has greatly reduced his or her quality of life and which is no foreseeable treatment. Passive euthanasia. Passive euthanasia is fairly common and typically involves a doctor withholding medicine or treatments that are allowing a person to continue living. Passive euthanasia differs from mercy killing, or in that a doctor does not administer a substance or any treatment meant deliberately to end a person's life. Instead, a doctor will agree to withdraw medical treatment when it is clear that a person will not recover from a terminal illness. As such, this type of euthanasia is viewed by many as a way to end suffering in terminally ill patients. Ways of implementing passive euthanasia may include not feeding a patient or discontinuing the administration of fluids necessary to keep the patient hydrated. By not administering such basic life-sustaining care, a terminally ill patient eventually expires. In the absence of an agreement to withhold these elements of care, a patient may linger in a painful or vegetative state for several months, years, or even decades. Euthanasia laws in most jurisdictions do not consider passive euthanasia to be a criminal act. Assisted suicide, however, is legally considered a criminal act in most places. The difference between the two is highlighted by the fact that passive euthanasia is seen as a non-interference of death's imminence, while active euthanasia is the deliberate administering of medication or activity with the direct intention of causing a person's death. Among the reasons that some oppose passive euthanasia is that unending pain and suffering or an altered state of consciousness may not be the sole reason for its request. Instead, some believe that the withdrawal of medical treatment, even when sought by an individual patient, may be at times requested as a way to relieve caretakers of a future burden or to help a terminally ill patient avoid a loss of dignity. Arguments for euthanasia. 1. Respect for autonomy in voluntary euthanasia. It asserts that if there is one thing over which we should be able to exert absolute control, it is then our own lives. If an individual thus decides that death is preferable to life, then she or he should be free to end that life. This argument rests on two premises: that self-killing is an acceptable or permissible expression of autonomy, and secondly, one's autonomy is to be respected. One can only be free to exercise one's autonomy in ways that will not bring harm to others. Number 2. Beneficence, mercy, and utilitarianism. The imperative to act benevolently is considered to be one of the most important ethical principles, along with non-malevolence governing medical practice. The argument from beneficence or utilitarianism justifies euthanasia of those who are incompetent to request death for themselves. Beneficence can be expressed equally by respecting autonomy as it can be by relieving suffering. The principle of double effect. There is disagreement about why it is ethically permissible for a physician to cause a patient's death in the course of treating his or her pain. Perhaps the most common line of justification focuses on the physician's intention, which is to relieve the patient's suffering as distinguished from the unintended but foreseen possible side effect of hastening the patient's death. This distinction invokes the doctrine of double effect, according to which an action with a bad effect, that is the patient's death, can be justified if that effect is not intended and is necessary to achieve a proportionately good effect, that is relief of the patient's suffering, according to Boll 1991. There are cases in which it is difficult to determine whether a bad effect such as hastening the patient's death is intended or merely foreseen but unintended. For example, the patient says that she or he wants to die and also asks the physician to stop life support. And also in the case of pain and symptom control, it seems intuitively plausible that the patient's death is not intended, whereas it would be if the physician instead performed euthanasia by deliberately giving the patient a lethal injection. According to the doctrine of double effect, the first action can be morally permissible, whereas the latter is morally prohibited. Critics of the appeal to double effect do not argue that we must leave a dying patient's pain inadequately treated so as to avoid the risk of hastening his or her death, but only that the distinction between whether a death is intended or foreseen but unintended cannot support the great moral difference between permissible and impermissible killing. In the case of euthanasia, just as in pain and symptom control, critics maintain that the physician's end may be the good one of relieving the patient's suffering. In neither case would death be wanted by patient or the physician if the suffering could be avoided without it, but both patient and physician may be prepared to accept the patient's earlier death in order to relieve his or her suffering. Whereas the patient's death in the case of euthanasia is the necessary means taken in the causal path to relief of suffering. In the use of analgesics to achieve pain and symptom control, it is the unavoidable side effect following upon the relief of the patient's suffering. Together, these similarities throw into question whether the appeal to intentions in the doctrine of double effect can ground such an important moral difference between permissible and impermissible killing. Some base the moral difference on the fact that patient's death is certain in euthanasia, whereas in pain and symptom control it only becomes increasingly probable. Ethical framework for these decisions, which we have sketched here, can only guide decision makers in decision making. Many of these decisions will remain complex, uncertain and agonizing for those involved in them. Here are some assignments for you. Number 1, explain euthanasia as one of the major bioethical issues. Number 2, what are the arguments for and against euthanasia? Number 3, critically analyze the moral and ethical aspects regarding the permissibility of euthanasia. Number 4, whether voluntary euthanasia is equal to the principle of autonomy. Analyze. Number 5, how can euthanasia is different from physically assisted suicide? Explain. Here I can suggest some books for your further studies. Number 1, Bioethics, written by Edwards Remby and Glenn C. Graber, published by Harcourt Brace Jovanovic Publishers, London, 1988. Number 2, Bioethics, Readings and Cases, written by Boddy Baruch, A and H, Tristram Engelhardt and published by Pearson Publishers, Delhi, 2007. Number 3. Principles of Biomedical Ethics, written by Beauchamp, Tom and Childress, James F. Published by Oxford University Press, Oxford, 1979. Number 4. Questioning Ethics, Contemporary Debates in Philosophy, written by Dooley Mark and Richard Kane, published by Routledge, London, 2002. Number 5. A Philosophical Disease, Bioethics, Culture and Identity, written by Elliott Carl, published by Routledge, London, 1999. Number 6. Applied Ethics and Social Problems, Moral Questions of Birth, Society and Death, written by Fitzpatrick, Tony, published by Policy Press, Great Britain, 1988. Thank you for watching this session. We will meet again in another session. Till then, bye.